you ever been told there's nothing you can do for your neuropathy because all your blood work was normal? Well, let me show you a real example. This neuropathy patient's homocysteine level is 17.4. Now, most people with neuropathy had never had this test performed. In fact, in all my years helping people with neuropathy, I can count on one hand the number of patients who had their homocysteine checked before coming to our office. So why do I care about this number? Because your nerves don't just need to exist, they need blood supply. Every nerve in your body depends on thousands of tiny microscopic blood vessels called capillaries. These vessels deliver oxygen, nutrients, and remove waste products. When these capillaries become damaged, the nerve doesn't get what it needs to survive. Over time, the nerves become damaged and lose function. That's where homocysteine becomes important. Research has shown that elevated homocysteine, which is a normal byproduct of the metabolism, can damage the delicate lining of these tiny blood vessels. Homocysteine reduces nitric oxide, which your blood vessels need to relax and to stay healthy. Homocysteine promotes inflammation, and ultimately, this impairs the flow of oxygen and nutrients to the nerves. Now, does a homocysteine level of 17.4 prove that we found the cause of this person's neuropathy? No, but it does tell me that we found something likely contributing. And then I immediately ask the next question. Why is the homocysteine elevated? The first place I look is vitamin B12. Now, this patient's B12 level is 573. Most providers would look at this as normal, but there's where we think differently. So if B12 appears normal, yet homocysteine is high, they may need additional B12 to be optimal at the cellular level. Because normal on a lab report doesn't always mean optimal function inside the body. This is the difference between symptom management and root cause investigation. Most neuropathy patients are told what diagnosis they have. Very few are helped to understand why the nerves are continuing to break down in the first place. That's the conversation we believe every neuropathy patient deserves to have.